He told me he hadn't cried since he was 9 years old. Said it like it was something to be proud of. And then I uncapped the syringe, and his whole face went the color of old chalk. I didn't laugh. I wanted to, but I didn't. His name was Marcus, and he was, I'd guess, somewhere in his mid-30s. The kind of man who fills a door frame when he walks through it. Big shoulders, careful posture, the kind of hands that look like they've built things. He'd come into the clinic on a Tuesday afternoon, late enough that the waiting room was almost empty, early enough that I still had coffee in my cup. He sat down across from me and said, very calmly, very deliberately, "I need a vitamin B12 shot. My doctor ordered it. I'm fine with needles." He was not fine with needles. I could tell by the way he'd already gripped the armrests, by the way his jaw was set just a little too tight, like he was holding something in place by sheer force of will. I've been doing this long enough to know the difference between someone who's genuinely relaxed and someone who is performing relaxation for an audience of one. I set his paperwork aside and just looked at him for a second. Not in a clinical way, just looked. "When's the last time you actually had one of these?" I asked. He thought about it. "Maybe 8 years ago?" "And how'd that go?" A pause. "I left before they finished." There it was. I smiled, not unkindly, and pulled my rolling stool a little closer. Not close enough to crowd him, just close enough that he'd have to actually look at me instead of at the tray of supplies. That's a small thing, but it matters. When someone is afraid, the worst thing you can do is let them stare at the instrument. The needle becomes enormous in the imagination. It grows. It develops a personality. It becomes the whole room. So you become the whole room instead. "Okay," I said. "Here's what's going to happen. I'm going to ask you a few questions. You're going to answer them. And somewhere in the middle of that conversation, we're going to be done and you won't have even noticed." He looked skeptical, which was fair. "What do you do?" I asked, pulling on my gloves. That soft, powdery snap of latex, the way it settles over your fingers like a second skin. "Structural engineering," he said. "So you spend your days making sure things don't fall down?" "Basically." "Good," I said. "Then you understand load bearing. You understand that the point isn't to avoid pressure, it's to distribute it correctly." He blinked. "Are you using engineering metaphors to distract me from a needle? Is it working?" The corner of his mouth moved, just barely, but it moved. I had him shift in the chair, turning slightly so I could access the outer upper quadrant of his arm, the deltoid muscle, which is the standard site for an intramuscular injection like B12. A lot of people assume these things go in the inner arm, near the vein, like a blood draw. They don't. This is muscle, not vein. Completely different sensation, completely different technique. I always explain what I'm doing, not in a clinical recitation kind of way, not, "I am now palpating the injection site," but just talking, narrating softly like I'm describing a walk through a familiar neighborhood. "I'm just going to feel the muscle for a second," I said, and I rested my fingers lightly on his upper arm, pressing gently to locate the right spot. The deltoid has a kind of density to it when it's tense. You can feel the fibers holding, bracing. His were absolutely braced. "You need to let this go," I said quietly. Not an accusation, just an observation. "I'm trying." "I know. Try less hard." He laughed, a short, surprised sound. And then that half second of laughter, the muscle released. Just a little. Just enough. That's the secret, honestly. You can't force a muscle to relax. You can't command it. You have to trick it into forgetting to be afraid. A laugh works. A sudden question works. Sometimes I'll ask someone to wiggle their toes. Sounds ridiculous, but it pulls attention downward, away from the sight, and the body follows attention like a dog follows a scent. I clean the skin with an alcohol swab, cool, sharp-smelling, that particular medicinal clarity that I've always found oddly grounding, and let it dry for just a moment. That matters more than people think. Injecting through wet alcohol can sting and introduce irritation. You wait. 10 seconds. It's not long, but it's enough. The needle was a standard 1.5-inch 23 gauge. For an intramuscular injection into the deltoid, you insert at roughly a 90-degree angle. Straight in, confident, no hesitation. Hesitation is what hurts. A slow, uncertain needle is far more uncomfortable than a quick, decisive one. The tissue doesn't have time to brace if you're faster than its instincts. I didn't count down. I never count down. Counting down is a promise of pain. Instead, I said, "Tell me something about load-bearing walls." And as he opened his mouth to answer, I went in. He stopped mid-sentence. "Did you just?" "Mm-hmm." That was... I know. I aspirated slightly, a quick check to make sure I hadn't inadvertently hit a vessel, which is rare in the deltoid, but worth the habit, and then delivered the medication slowly and steadily. B12 has a particular viscosity to it, slightly thicker than saline, and you push it in over about 10 seconds, not all at once. The muscle absorbs it better that way. Less pressure, less discomfort afterward. Then I withdrew, smooth and clean. Pressed a small piece of gauze to the site. Just light pressure, nothing dramatic. And said, "Done." He stared at me. "That's it?" "That's it." That was nothing. "Most things are," I said, "once you stop imagining them." He was quiet for a moment, looking at the tiny piece of gauze taped to his arm like it was evidence of something. I started tidying up, capping the used needle for disposal, peeling off my gloves, the small, orderly rituals of after. "I should mention," I said, not looking up, "you might feel a little sore there tomorrow. The muscle sometimes reacts to the volume of fluid. Just a mild ache, like you bumped it. If it's warm or swollen after 24 hours, that's worth a call. But usually it's nothing." "Okay." "And drink some water today. B12 can make some people feel a little energized, almost jittery, especially if your levels were low. That's normal. Don't let it keep you up." He nodded, standing slowly, like he was testing whether his legs still worked. They did. At the door, he paused. "The engineering metaphor," he said. "Did you come up with that on the spot?" I considered this. "I have a whole catalog," I said. "Depends on the patient." He smiled then, a real one, not the performed kind. The kind that reaches the eyes and stays there a second longer than it needs to. "Thank you," he said, and he meant it in the way people mean things when they've been a little braver than they expected to be. I watched the door close behind him and stood there for a moment in the quiet of the room. The faint antiseptic smell, the hum of the HVAC, the small orderly tray with its evidence of a thing completed. There's a particular kind of satisfaction in it. Not pride exactly, something quieter. The knowledge that for about 4 minutes, someone trusted you completely, handed you their fear along with their arm, and you held both carefully and gave back only one of them. I poured the rest of my coffee down the sink. It had gone cold while I wasn't paying attention. Some things you don't mind losing track of.